Hello and welcome back to Dr. Carri's Clinical Corner. And today we're going to talk about when Kegels are not enough. I swear I've made this video before, but until people stop coming to my clinic and telling me Kegels didn't work for them, then I'll stop making these videos. But I was thinking about it, and there's so bladder leakage, let's start with this. Bladder leakage has sort of some subcategories. So one category we call stress incontinence, and that means like the physical stress makes you pee. So the physical stress meaning exercise like running or jumping, or it can be the physical stress, the pressure from coughing, sneezing, laughing. All those things cause a lot of pressure down on the pelvic floor. So that's stress incontinence. There's also something called overflow incontinence. So like if your bladder gets too heavy, you're gonna leak urine. If your bladder gets too full, you're gonna leak. So that one, self-explanatory. Don't let it get that full. Go more often. And then another category is called urge incontinence. So it's sort of like when I feel like I need to pee, then I pee a little or a lot. Or like on the way to the toilet, I pee. I can't quite make it to the toilet. So that could be overflow incontinence or urge incontinence. But most of the time I would categorize it as urge incontinence. So those are kind of like three types of incontinence. And Kegels aren't the answer for all of these. So overflow incontinence, Kegels are gonna help you make it to the toilet, but you probably just need to like pay attention to your body and go a little more often. So you're not waiting till the bladder is like full. And then urge incontinence, most of those people, when I see them in the clinic and we test the pelvic floor, they're very, very often their pelvic floor is completely normal. They don't have weakness, they don't have tightness, they can like Kegel, like no problem. And for those people, it's mostly bladder habit. So a lot of times I think that comes out of something else, like they're afraid of having leakage, like maybe one time or a few times they had some bladder leakage. So now they just go all the time so that their bladder never gets too full and hopefully they don't have leakage. But what happens is the bladder gets smaller, it can't hold as much, the signal in the brain gets stronger, like I need to go every time I feel a little bit of urine in the bladder. And so we got to sort of like rebalance those. I've been talking about this a lot in the clinic lately. And so we got to get your bladder to hold more, and we got to get the brain signal to calm down so it's not so strong. It's not telling you need to go constantly. It's sort of in proportion to how full your bladder is. So for a lot of those people, they could Kegel all day. Kegels are not the answer because Kegels aren't going to give you bigger bladder capacity. Kegels calm down the brain signal a little bit, but not completely. And so we got to work on their habits to create more capacity in their bladder and less like urgent signals. And that can also feed into overflow incontinence if you're waiting too long. So there's sort of a happy medium, which is about 2 to 4 hours. For most of my patients, 2 to 3 hours. But 2 to 4 hours is like the normal amount of time to pee. And it's normal to pee none at night, or if you're over 65, to pee once at night. If you're pregnant, all bets are off. You're not in any normal category. You're in pregnancy category. The baby is growing straight on top of your bladder. You're gonna have to pee a lot. Okay, and then the other category is stress incontinence. And so these are the people that are giving Kegels for days, but it doesn't fix their problem. So it's a pressure problem. So either like coughing, sneezing creates a ton of pressure down on the pelvic floor and the bladder. And so the Kegels, the pelvic floor muscles, they're thin, small muscles. They're not that thick or strong. They're not meant to like hold a ton of pressure. So what I see in my patients in the clinic is like, someone just told me to do Kegels, my doctor just told me to do Kegels, or Worst case scenario, I went to a pelvic floor therapist that just gave me Kegels. And you know, often what I find with these people, sometimes there's weakness. So if there's weakness, we work on it. If your pelvic floor muscles are weak, we work on it. Absolutely. I'm not never Kegels. But there's so much more to bladder leakage. And so often what I find with a lot of these people that either they have bladder leakage, with coughing, sneezing, or with exercise like running, jumping, lifting weights, something like that. So again, Kegels are small, thin muscles. They are not going to overcome a ton of pressure. So a couple things with coughing, sneezing, I tell people like, let out your sneezes. So then the pressure goes this way, not this way. Try it, see if it helps. You know, but a lot of times what I find when I examine these people in the clinic is they actually have tight pelvic floor muscles. So the other way to think about it is the pelvic floor is like a hammock or a trampoline. And I show people this through what we call biofeedback, is every time you move your leg, your pelvic floor muscles briefly go on and then they go off. And so that is sort of like this trampoline thing. So if your muscles are tight, there's not much to that trampoline, and it's just, right? And so then too much pressure, running, jumping, or coughing, sneezing, like you don't have that much strength because the muscles are already tight. And so with running or jumping, it's sort of like the pelvic floor muscles should like briefly contract as you land, and then they should relax again. So it's sort of like on off. They can't stay contracted or there's nothing to contract the next time. You know, this is like a simplistic explanation, but this is what I see. And until people stop doing Kegels, and again, I'm not blaming it on patients, they're getting bad information either from the internet, from their doctors, or from pelvic floor therapists who are not fully educated yet. And so then they come to my clinic like, it's been 2 years, I've done billions of Kegels and I still leak. And it's like, we got to look at these other things. Is there tightness? Is there something in your athletic ability? Like, do you land with stiff legs? Do you run really upright and stiff? Your whole body needs to like absorb these forces. And then coughing, sneezing, do you let it out, right? Is there tightness? Is there weakness in something else? Is something else tight that's preventing this? So just had to rant for a minute that it's not always Kegels. So I have an online bladder course. It talks about all these things. You could take the free introductory course. It's all about all the other things. So initially I made it for the people that have urge incontinence, urinary urgency frequency. I made it for those people because oftentimes their pelvic floor is completely normal. It's functioning perfectly. So I made the online course for them because I'm like, I don't really need to see them in person. Like, this is the protocol. These are the steps to go through. Here's what to do if that's not working, right? It has like 40 videos, 30 videos, I don't know. But then I added videos about what to do with like running, jumping. And so it kind of covers all the bladder stuff. So go take the free course. You will learn something. And if you need help, see a pelvic floor therapist, see me virtually. Come see me in person in California. There's help. Okay.